So, good day, sir. I'm Maricel Alvis, and I'm your student nurse. And for today po, I will be performing your male genitalia assessment po. So, before that, can you state your name, sir?
Felix Alvis.
Age po?
50.
So, before that, sir, I will ask you a few questions po. Pag umiihi po ba kayo, may nararamdaman po ba kayong masakit?
Wala.
Wala po, okay. Sa gabi naman po, madalas po ba ang pag-ihi nyo?
2 times.
Okay po. 2 times. I'll take note of that po. Is there any abdominal pain na nafe-feel nyo po?
No.
No? Is there any swelling na nafe-feel like bulge or buccal po?
Wala.
Okay. History of blood in stool po?
Wala din.
Wala po. Sa family history naman po, meron po bang may prostate cancer sa family niyo po?
Yung tatay ko.
Okay, I'll take note of that. So, it is necessary po to assess your male genitalia to ensure that everything is okay and everything is fine po. So, before that, sir, I will wash my hands and close the windows to provide privacy. So first, we will inspect the base of the penis and the pubic hair for growth, pattern and excretion, erythema, or infestation. So, we will inspect and we will not touch it, okay? So, we will inspect muna. Next, we will inspect the skin of the shaft for rashes, lesions, or lumps, okay? So next, we will inspect the urethral meatus of the patient if there is any lesion, swelling, inflammation, or discharge. So yung normal na meatus is nasa center siya. And if hindi nyo makita sa client nyo yung meatus, ask your patient if paano siya umiihi or saan siya umiihi. Next, we will palpate the penis for tenderness, thickening, and nodules. We will use the thumb and first fingers. So, we will palpate here from the base, going to the shaft slowly, and going to the meatus. So, as you can see, this is the tip of the meatus, and we will squeeze it softly if there is any discharge coming from it. So, if there is any discharge coming from it, you will document your findings, including the color, the consistency, and the smell. Okay. So next, we will inspect the scrotum. This is the scrotum, these two. We will inspect the size, shape, and position of the scrotum. So we will observe. We will also observe if there is any swelling, lumps, or bulges in the scrotum. And we will inspect the skin color, also integrity, and the presence of lesions or rashes. So, pag nakita nyo na hindi pantay yung scrotum, maybe there is abnormalities. So, you will take note of that. Okay? Next. So, next, we will palpate the scrotum to assess status of underlying testes, epididymis, and spermatic cord. So, we will palpate the both testes simultaneously for comparative purposes. So, we will palpate the testes slowly, okay, and gently because sometimes it's painful for the client. Okay. So, if there note the size, shape, consistency, and the presence of tenderness if there is any tenderness or nodules of the scrotum of the client. But as you can see, wala naman pong problema. It's all normal. Okay. So after that, after you inspect, palpate the male genitalia of the patient, and if you can, if there is any noticeable or you feel any tenderness or abnormalities, you will take note of that, and you will refer your patient to the physician. So, thank you.